Good morning, everyone. You're watching Atlanta and Company. I'm Christine Pilara. Many have questions and concerns when it comes to their reproductive health. Well, luckily, right here in Georgia, there's a facility that specializes in helping bring new life into this world. Reproductive Biology Associates was established in 1983 as Georgia's first IVF treatment center. Their list of physicians have a combined 170 years of experience in diagnosing and treating infertility. Joining me this morning is Dr. Michael Witt and patient Robert Batchelor. Thank you both for being here. We appreciate it.
It's great to be here, Christine.
Of course. Well, tell me, Doctor, what are we talking about today?
Well, today I had the chance of coming back and actually introducing you to Robbie Batchelor, who is one of my patients, to help sort of describe the process of what it's like for a male to go through the evaluation of an infertility condition. Okay,
so Robert, tell us your story. Did you and your wife trying to conceive, and then you thought you were having issues, or take us to what brought you to the clinic in the first place?
Well, my wife and I have been married for a little over 5 years, and we finally decided, okay, we're ready to start having children, try to have children. And a few months went by and no luck. A little over a year went by and still nothing was happening yet. So we decided to look into it and see if there were any issues. And first we went to her doctor, and she, which is I think usually the case, you assume it's on the woman's side, but her test came back normal, so then it was my turn. And I went to see a local urologist in Rome, which is where we live, and after a few tests he said I probably needed to see an infertility specialist. So he actually referred us to RBA and ultimately to Dr. Witt's office.
And talk about what you had done there. What is it? Because there are a lot of people who might be experiencing the same thing, and they're just thinking like, oh, as the man, let me go through all these things that typically, as you said, women go through. So talk about the male factor here and what you had to experience.
Well, after the test, Dr. Witt told us that mainly due to factors on my side that we had a very, very small chance of getting pregnant on our own. And he walked us through the options that we have and through some procedures that he's able to perform. And then using IVF, we were able to ultimately get pregnant.
Yeah, congratulations.
And our son was actually born in February. So.
Wonderful. and Doctor, give us kind of the medical, now that he told us what it was in layman's terms, kind of describe what you, right? You're like, I'm no doctor. Let the doctor tell us exactly what happened, what you did.
Yeah, well, Robbie had one of those conditions that even 20 years ago probably would not have allowed him to establish a pregnancy with his wife. And it was really a production problem with the sperm that required retrieving those sperm and then using it with IVF in order to establish a pregnancy.
And so that's what happened ultimately. And how long from when you started to see him till the pregnancy?
It was approximately 2 years, I think, from my first initial consultation in his office until we got the news that Tracy was pregnant. So.
Oh, that's fantastic. And what would you tell other men out there who might be experiencing the same thing and maybe feel reluctant or feel uncertain about going to see the doctor?
Well, it's definitely a strange feeling to know that you're the reason that your family's not able to grow and have children. But the odd thing is, as we've gone through this journey and this process, we've met so many people that have gone through the same thing, and we've been able to support them and get support from others, that there's no reason to go through it alone or to think that there are no options, because my little son at home makes whatever I went through absolutely worth it, and there's no good reason to deal with the frustration and the disappointment when there are options to remedy that.
Right. And Dr. Witt, I imagine this is such a, having that kind of support and meeting people that are in the same boat as yourself, I imagine that's something that years ago, decades ago, men wouldn't even have been talking about.
Yeah, that's correct. I mean, typically the wife shouldered most of the burden, and men really would either not come forward or there just was not a lot we could do for them.
And do you feel like Robbie's case is common, what you're seeing right now?
Yeah, in my practice, it's probably about 10% of the patients that I see, and just very rewarding, to see this kind of outcome.
I bet. And what would you like patients to know, male or female, about your clinic and about all the wonderful work that you've done over the years in bringing a new life into the world?
Well, I mean, with couples who want to have a family, I mean, that is really a strong desire because it really taps into longings for home and for relationship and intimacy. And when you see that deprived and the frustration or even the pain that goes with that, I think Robbie and Tracy are just great examples of their willingness and humility and perseverance to come through that whole process, to know it's there for them and that their ability to go through it has resulted in them being able to have a pregnancy. And I think they're great models, for other couples who may be facing the question or are ready to give up on it and haven't really gone to the right people or just spent enough time.
Yeah, and it's something, I mean, you mentioned up feeling like, oh no, you were shouldering all that responsibility and burden, but at the end of the day, it doesn't matter what's happening. It's the end result that you got the help that you needed, and now, you have the family that you've always wanted.
Absolutely.
So, congratulations.
Thank you so much.
That's wonderful. And again, if you would like more information about Reproductive Biology Associates, give them a call right now. It's 404-257-1900, or log on to their website at rba-online.com. And this segment was paid for by Reproductive Biology Associates.